Matt Hancock there, the Health Secretary. Well, up until now, the opposition has been relatively supportive of the government's actions on coronavirus. Is that about to change? Well, listening in to that interview was Labour's Shadow Health Secretary, Jonathan Ashworth, who joins us now from Leicester. Thank you very much for being on the programme. We've just heard from Matt Hancock, who says the government is going to be looking at bringing in emergency powers next week, that he's been working with you on some suggestions. What kind of thing can we expect to see?
Well, can I just say at the outset that we support the national effort to deal with, to contain and delay the spread of this virus. People are concerned, people are worried about what to do for their elderly relatives, how to keep their loved ones safe, and we think it would be entirely irresponsible of us as an opposition to make this a sort of party political thing. But equally, it would not be responsible of us not to voice the concerns that are being voiced more widely in the scientific community, not to probe the government, not to ask questions. We do that not to undermine the government, because we want the government's strategy to succeed, but we think it's important that we can all reassure ourselves that the government is taking the correct approach. Let me just give you one quick example. The World Health Organization is saying that we should continue testing and contact tracing. They're saying that is the best way to break the chain of contagion. The UK government have taken a different view, that if you feel ill, that you just stay at home for 7 days and won't be tested. Many people are saying to me that they need a COVID-19 test if they're ill, because they need to know whether they should be interacting with other people in a few weeks' time. I mean, if you've got elderly relatives and you take 7 days off work now because you've got a cough, what happens in a month's time if you've got a cough again? Do you take another 7 days off work? People need certainty. So I just need to understand better why the government is taking a different approach based on its science from other countries. And I think that's why it's so important that all the scientific modelling, for example, is published. We called for that last week. The government have said they are going to publish it, because we have to take the public with us on this. And on that, more broadly, it is utterly unacceptable for government, sources, whatever, to be briefing journalists overnight on issues which are very, very fundamental to how we deal with this virus, very fundamental to how our society is going to operate in the coming weeks. If things have changed since Thursday, and things are changing quickly, if things have changed since the Prime Minister's press conference on Thursday, then really the Prime Minister should be doing another press conference today and explaining why things have changed.
You mentioned there about how the government seems to be taking different action to some of what we're seeing in other countries on, for example, school closures, travel bans, non-essential businesses such as pubs and restaurants staying open. Do you think we should be doing more in terms of closing down these kind of institutions?
Well, I think we need to understand better why we seem to be taking a slightly different approach to some of our comparative countries and nations internationally. People are asking us why we are not taking these more far-reaching, stringent measures. People in the science community are asking that. The issue is that it's not for me to adjudicate on the science and come down in favour of one set of scientists or another, but I think it's important that when people are raising concerns, that the government modelling is published and it can be scrutinised and they have a clear explanation. So that's on the science. More broadly, though, I do have more broader concerns about the government's preparations generally. We know that this virus is going to be really a real problem for the elderly and the vulnerable in society. It's going to be a real problem for the poorest in society. We want to make sure that our NHS has got the resources it needs, that our social care services has the resources that it needs, that those who need to take time off work have proper sick pay and are not financially penalised for taking time off work, that our elderly who are being told to isolate potentially for 3 or 4 months are going to get the support that they need in the wider community, because that's going to have huge social implications. These are the questions that we really want to put to the government, and we need reassurances that the government have a resourced plan and a considered plan that can maintain public confidence.
Talking about resources, in the interview with Matt Hancock, he was saying that the provision of ventilators is effectively the priority now. They've only got 5,000, they need many times more that. If you produce a ventilator, we will buy it, no number is too high. Some people listening to that will be quite worried that we don't have enough ventilators. Is the NHS prepared?
Well, the NHS needs more resources desperately. I mean, we have stories of clinicians on the front line treating COVID-19 patients who don't have adequate protective masks and goggles and clothing and so on. We know we don't have enough beds in the NHS. We certainly don't have enough intensive care beds. We need to understand whether the government is able to scale up the intensive care bed capacity to levels that many are suggesting that we would need. We've been raising for some time now the point about ventilators, and we need to buy up those ventilators. We should have been doing that weeks ago. But of course, ventilators need staff to operate them, so we need to understand how staffing will be changing in the NHS. And many NHS staff are getting in touch with me privately because they are desperately concerned. They're hearing reports from other health workers in Italy. They're seeing what's happening in Italy, where the health service looks like it is under intense strain, if not becoming overwhelmed. And many NHS staff are looking for urgent reassurance that we won't be in that position. I mean, in Italy is a G7 country, and they've got international aid bodies like MSF going in to help their efforts on the front line. I mean, NHS staff are raising these issues with me directly, and I think ministers urgently need to reassure us that they have a resourcing plan in place to support our NHS staff who are on the front line in this battle with coronavirus.
I just want to go back to the very first question that I asked you. Matt Hancock saying the government will be seeking emergency.
Sorry, I didn't answer. Sorry.
In Parliament next week. Yeah, I'm going to make sure you do answer this one before you go.
Sorry.
You've been working with the House Secretary on these emergency powers. What kind of thing could we see?
Well, of course we want to cooperate, because this is not a party political issue. But we will be voicing our concerns. We will be asking the government to reassure us that some of the very stringent powers they're hoping to put on the statute book.
What emergency powers specifically
only be used
are under consideration?
Well, I mean, the things that you've seen in the newspapers are the things that they're talking about. I mean, powers over quarantine, powers over what. But actually, some of the quarantine powers are already on the statute book, because we had to amend the regulations last week. But what we're really concerned about is issues like sick pay. People who are low paid and who need to take time off work should not be penalised for it, because they'll be asked to make a choice between financial hardship and their health, and that is not acceptable.
OK, and then just finally, while we've got you, lots of people are very worried about food supply. They'll be going into their local Asda, Tesco, Sainsbury's, Waitrose, seeing empty shelves, waiting for weeks for a delivery slot that they can book. Are people selfish who are stockpiling some of these essential items?
No, I don't think that. People are worried, and I think the broader point is this: we really need a mass coordinated effort. I mean, I was very fortunate in many ways that I worked in Downing Street for Gordon Brown at the time of the financial crash. Gordon Brown gripped that issue and led an international effort on it. We need another big coordinated international effort on this, because certainty is everything. People need advice, and this virus spreads quickly and it exploits ambivalence. We don't want any ambiguity. People just want clear advice, not briefings to journalists overnight. The Prime Minister should be out there daily, speaking to the nation and explaining why things are changing. I appreciate this is fast-moving, but what we've seen with the panic buying is a reflection of the uncertainty that is out there, which is why I would really urge the Prime Minister to be more on the front foot. I'm not trying to be sort of scoring points for the sake of it, but people want that certainty, and they want to be reassured that government has a grip. That was the big lesson we learned when we were in government and Gordon Brown responded to the financial crash in 2008.
Thank you very much, Jonathan Ashworth, there, laying out Labour's side of the story.